You're listening to The Drive Home on 97.9 XFM.
All right, guys, it's 4:30 on the drive home for a Tuesday. Wayne, Tanya, and Brian all alongside.
Oh, yeah.
And we are very pleased to bring in a guest this afternoon, Dr. Ryan Jennings, the Chief Medical Officer at HSHS St. Anthony's Memorial Hospital, joins us once again to talk about a lot of things happening around the area with COVID-19. Doc, good afternoon. How are you?
I'm well, guys. How are you doing?
Thankfully, we're all doing well.
We're okay.
Pretty good.
Knock on wood. Everybody here so far?
Keep everybody that way. Keep everybody safe. That's the goal.
We're
That's
trying.
Right. Obviously, Doc, we got to dive right into it. The state saw a dip for a couple of days of numbers. Now things have jacked back up. And we also have now 36 cases of COVID-19 coronavirus in Jasper County and now 5 here in Effingham.
You're spot on, and let's talk about kind of the first part of that, just the overall uptick in Illinois, and some of that gets the idea of our desires to be doing additional testing and the conversation about that, and the state trying to work around opening up additional testing sites, especially in the larger metropolitan areas and some of that stuff. So you're seeing some uptick as a result of truly getting additional testing done. What they're trying to get at is how prevalent something is in the community. So if we do testing and there's a high percentage of the tests that are done are high, if that percentage is high, then you're much more concerned about how much is really just out there in the community, and thus the greater need to continue this, staying safe at home and those types of things. If you start seeing that trend down, as a percentage, then you get a little bit more reassurance around the actual prevalence. Right now, it's a little too soon to make a decision about the disease prevalence, but I think what you're seeing as far as the actual raw numbers having an uptick is starting to reflect the fact that we are having additional ability to do testing. Now, locally is a little bit of a different phenomenon, and I think most of us realize that the unfortunate situation that we've seen, and I know that you guys have spoken to around the skilled nursing facility in Jasper County that unfortunately has an outbreak. And, you recall when this first happened in Seattle, really, just how quickly these things take place within what we call congregated living facilities. If you go back to when we first started talking about this and how one of the areas that we were going to focus on for testing were congregate living facilities and symptoms in those facilities. Well, this is exactly why, so that you can isolate those down as soon as possible and take action as much as you possibly can. Kudos to the team down there that's been really going around the clock. The folks at the home itself, the Jasper County Health Department, and I didn't realize actually the Illinois Department of Public Health has a long-term care subdivision that specializes in outbreaks and things like that in these types of facilities, and they've been working collaboratively. They provide support for infectious disease physicians, you name it. But unfortunately, it continues to evolve, and with that, the healthcare workers become affected, and of course, they're in the community. So we have to remain extremely vigilant that those that not just there but anywhere can actually still have this and be carrying it and not necessarily realize it. And so the other part to highlight there just quickly is you see some of the uptick in Effingham County, and I can't speak specifically, obviously, in any case, but keep in mind there's always the thing that we talked about a while back, that you're always reported in your county of residence. And so, regardless of a potential source or where you even were when it happened, when you were diagnosed or or unfortunately passed away, you're reported in your county of residence. So, for example, if you had folks that maybe work in Jasper County but reside here, those numbers would be reported in Effingham County. And I don't know that that's the case for any of these particular cases, but to me, it speaks to the idea that we're not that the county line is a really nice thing on the map, but it doesn't have a whole lot to do with how people move about, and means that even if there's 0 cases here and 0 cases there, there's still this extremely high risk of moving around and not social distancing.
Well, and not to put our finger on that, but that has been, from the social media standpoint here at the radio station, Doc, that's been a bit of a hot button with people talking about that there was a case for Effingham County that happened in Chicago, that the person did or did not live here, but they did live here but worked up there. And so technically your residence would be here, even if you have an apartment in Chicago or whatever. It's no different than if a guy lives in Alabama but works on an oil rig and dies on an oil rig. He still lived in Alabama.
Correct. Or when we talk about what we call vital records, so that's birth records, death records. In this case, looking at infectious diseases, if a woman passes through Effingham and gives birth in Effingham County, they'll have a birth record recorded elsewhere. We'll have it, but here, but it won't show up in our vital records in the same way. So, so it's kind of interesting the way those types of things are reported. And there's reasons why they do that. I mean, when the numbers are small, it's really kind of confusing because you're going, wait, there's one. Who was it? I know everybody in this town.
Yeah. Right.
But when there's thousands, then suddenly, it doesn't be that one isn't quite as apparent. So, you try to look at aggregation of data. So, I will tell you the crisis that I'm concerned about and that I have a request of those in the community is that, as Jasper County works their way through this, there is going to be a need, I'm certain, of additional support for people to help at that nursing home. And I'm not sure, a lot of folks probably, it was maybe 3 weeks ago, got this text message that said, hey, if you have, if anybody with a license, you got this weird text message that said, go to IllinoisHelps.net and register if you're willing to volunteer to assist during this pandemic. And that's actually what that site's all about, is when you get into one of these situations, if you've registered, then the Department of Public Health can go in there and look at people that live geographically and what their certifications are and say, you know what, we could really benefit from a doctor. And, they now have your contact information. They can call you up and say, hey, would you be able to help us out? So if you can go out to IllinoisHelps.net, it's very easy to do. And then that can be an incredible resource for the departments of public health during these times of crises.
All right. One quick question, we've all got questions, but one quick one that did come from a listener, not on our social media pages, but is one of the reasons why our area hasn't seen such a big outbreak, aside from the fact that we don't have as many people as Chicago and St. Louis, but that this virus, when it hits an area, it kind of has a stone in a puddle effect. So when it hits an area, it's, the people that are close to it, the ripples are going to be tighter, and as it moves outward, it just takes a while for it to get there.
There is that. I mean, if you look at kind of how it hit the U.S., that pebble was an airplane landing.
Right.
They landed in New York, they landed in Chicago, they landed in California, they landed in Seattle, and then in those cities that especially have a very congregated living environment. When you're in Manhattan, if you're 6 feet away from somebody, you're
lucky.
You feel lost.
Yeah,
you feel lost. And so it obviously functions just like a skilled nursing facility for all practical purposes. And so it blows up, and then as it slowly goes out in those, to the analogy, those ripples, they get smaller and smaller as the population density gets broader. And then, by the time you're, to us, we're actually very, very lucky that we're able to, I get a little creepy if somebody's 6 feet away from me going, what are you doing? Go. So we're just very fortunate in that regard. But it's a really great observation that she's made there, that it is. It's like, dropping a puddle in a pond.
And the second part of her question was, does that also then mean that it's possibly a little too early to talk about relaxing some of the stay-at-home measures that are in place?
I do think it is, and I'm afraid we're going to still see some more of kind of these situations where something hits kind of, again, like the congregated living facilities here and there, where you'll see an outbreak, but because that's not always going to be contained just within the confines of the residence, because folks come out, and go home, you don't have to live there if you work somewhere, so they go back out in the community. They don't even realize they're sick. And, as we've talked about, the incubation period of a few days here, they could be 6-8 days into this whole thing before they really know. And even in these situations, even when you're trying to socially distance, you can still bump into several people, and that effect is amazing. I mean, when you see the number of cases that have popped up in the skilled facility there, you can just see how effective it is, because there's not a ton of residents there, and yet the numbers are rarely quite large. So if you're in close contact, and we've seen it in lots of examples throughout the country of people went ahead and had a birthday party, and one person had no idea, and then the next thing you know, and
Yep.
so and I'm just afraid as we get further out from when this first kind of exploded, we do become complacent, and so we want to continue to keep our guard up.
With that said, I know that I've heard different reports. I know you mentioned, they may not show symptoms maybe like for 6 to 8 days. Is the 14-day quarantine, is that long enough, or should it be longer? Should it be 21 days?
Well, what they try to do is pick a number that covers a large percentage, and so what we believe right now is the 14-day mark would capture around 80% plus or minus 5% of people. There are going to be a few people that might show up later, but they're going to be diminishingly smaller and smaller. And there's certainly examples that we now know that people continue to shed this virus if they've had it for weeks and weeks and weeks, and that's not unique to this particular virus. A lot of the other viruses that we've studied previously, you can still find it in people's saliva and stool. Remember Zika? What a big deal it was when Zika virus came around. They were still finding it in people's saliva and other bodily secretions for a long time, and so long after they had recovered. And so viruses sometimes do weird things like that, but the 14-day number seems to be very reasonable, and that was the numbers that have been used in other areas, and they've been successful.
Okay.
Yeah, one of the other quick topics that's constantly mentioned more and more is masks and what to do with them, how to wear them. And you can find most of the information out online, but I don't know if there's any quick way to summarize it, Doctor, but just from my own experience, I've started to use them out in public, and that's fine, and it's working. But I know they're not really readily available, so I'm going to try and reuse them. Like I say, in a general way, is there anything that you would tell people, maybe quick do's and don'ts with masks that are reusable, or fabric, or whatever, the ones that people would use in a day-to-day basis as we all are doing, briefly go out? You hear questions about heat or sunlight or washing or soap or microwaving, whatever. Any quick advice on that?
Honestly, your best answer for a fabric mask, if it can be laundered, launder it. Just run it through the washer or dryer. That is by far the best answer. As far as the other things that people have tried, there's probably nothing in your home that is a good solution, for like if you bought a paper mask, let's say, to try to stick it in your car windshield or your microwave or anything like that. Probably not going to do a lot for you. And remember, the purpose of this is really to catch your spit, so if you sneeze, cough, etc. So, it doesn't have to be a fancy thing. Just a scarf type thing is adequate to do what we're asking of those masks to do, as opposed to the masks that are worn inside the hospital that are really to kind of protect particles from coming in through the mask. So kind of they have kind of one's made to stop you from blowing out, and the other's made to stop stuff from being sucked in. And so probably your best move is a cloth mask that can be laundered.
All right, good enough.
Great. All right. Doc, one other question here real quick from our Facebook page, if you don't mind. And it's something that seems to be a hotbed every time we bring this thing up is, do you know why there haven't been more tests performed in the county? Is it a lack of tests? Is it a lack of people showing the proper symptoms to get tested? Or is it people that just aren't reporting the symptoms and not getting the test?
Well, so it's all three.
Yeah.
we certainly don't have just an enormous number of tests to put out a sign and say anybody that wants tests be tested, and you really shouldn't do that, because testing people with no symptoms in such small numbers is really something that you need to have done through a public health department type process, where they're trying to, again, get at that idea of how much disease is out in the community. So they pull in a wagon, they test 1,000 people, no matter what their symptoms are, and then they crunch some math and go, hey, it turns out that reality is 15% of people walking around have this. So if you had a ton of tests, you can go out and do these prevalence type studies. When you have a relatively small number of tests, then you want to limit the testing to the folks that are going to receive the potential most benefit, and so from the test. So when this first rolled out, that was people that were going to be hospitalized or people that had significant risk because of being in a congregate living environment. That was really the first two rules when the testing supplies were extremely tight. Now that we have had more testing supplies, they said, okay, now you need to be thinking about healthcare workers and people that work in, again, congregate living environments as the next population to test, in addition to people being hospitalized. But part of what you don't want to do, again, is give folks that idea that a negative test means you're free to roam. It means you should still stay home. And there's also a certain percentage of inaccuracies to any test. I don't know what test is out there that's 100% accurate, and so there is a little bit of even error within the testing that, as much as maybe 25-30% of the tests that are negative, somebody actually is positive, and that may be simply because they were very early in the phase of the disease, and so they didn't have very much virus. It may have been just something, just didn't pick up quite right, but they can lend themselves to a false sense of security. As a physician, we often have, conversations, somebody's wanting to test XYZ, and you're going, well, it's kind of a two-edged sword. It may not be the answer that you're looking for, and it doesn't always mean what you think it's going to mean. And the last thing you want to do is again give folks that false sense of security. So it's back to the idea of, I want to really focus on testing where it's going to then impact either the well-being of that person, so they're being hospitalized, and so I need to know so that I can make sure that I can plan for what you might expect and use appropriate resources to protect others from you and you from others. And then the other is, if I want to test someone who might potentially harm another, and that's where the healthcare workers come in, where I'm testing them to make sure that they're not accidentally going to go out and spread something. And now it is still supposed to be, regardless of those situations, someone who has symptoms. So even a healthcare worker, I can't call up and say, hey, I want swabbed. Well, I probably could, because, I could do weird things. But even as a physician, you can't just say, I want swab for the sake of being swabbed. You have to have respiratory symptoms, those types of things, because, that's when we got to know. And it helps the healthcare worker to go, okay, I do have a respiratory illness. I'm sick. Should I be quarantining? Because we all have an obligation to protect others, and if I know I have this, I definitely need to stay home. And so that's part of the decision making around, you test for two reasons: either to protect the patient themselves or to protect others from someone who might be sick.
All right, Doc, I know we've kept you on for a long time, and I'm sorry to take up so much of your time. I will tell you that in the time that you've been talking, the phone lines at the station have been lighting up with people asking questions. And Angela was nice enough to take one of those from a listener, and she's wanting to know one real quick question for you. She apparently fell down the stairs, has a torn rotator cuff, 4 different tears, and she's not able to get surgery done because they considered it to be elective. Do you know when that's going to get relaxed, or is that something that can be changed, or what's the story there?
That is a really interesting conversation, because and it makes a world of sense why we said, look, right now is not the time to be doing elective surgeries when this came out, because you didn't want to accidentally be in a hospital. Here comes this big surge, and you came in for something that could have waited, and accidentally became exposed, and now you get sick with COVID when really you could have tried to recover from this. And so the ban, or the decision around stopping elective surgeries that was put forward really by, you name it, I mean, the College of Surgeons, everybody adopted this, has now come into quite a bit of discussion for 2 reasons. One, there are some areas that haven't seen the prevalence that they expected. Up until just recently, we were one of those areas. And then 2 is that some of those things that we asked people to go ahead and wait 30 days or so are now 30 days. And they're going, Doc, I gave you my 30 days. Can I get this thing fixed? And so actually there was some papers just published, and there's a lot of people trying to now develop some algorithms on, okay, what are the types of things. There's always been the decision that basically if it's something urgent or emergent that would leave you with a permanent harm or disability, that type of thing, they need to be done. And so that's a conversation with your doctor. And, sometimes it's surprising what what the science behind certain things is, that even when they scheduled things at the hospital, I called the doc and said, why do you need one of those done? And then they explained it to him. I'm going, well, heck, I didn't know that.
Yeah.
If you didn't do that now, it might lead to big problems down the road. And so it's really a good conversation to have with your doc. But I will tell you that she's definitely not alone, and it is a difficult question being asked. But the number one step in that is knowing what the prevalence of your disease is in the community and making sure that it's on a downhill trend. And so locally, subject to some changes here, I don't see us making major moves around elective surgery, but, for the time being, because of the fact that we're still seeing an uptick. But again, they need to talk with their surgeon a little bit, because they're the ones that know what the potential downsides are. And like every surgery, there's always a conversation about risk and benefit. Even without COVID, there's always a conversation of, well, you could have this happen, this happen, this happen. Is it worth it? You might get a blood clot infection. All those things. Unfortunately, our conversations now have to also include COVID.
All right.
That makes sense.
Well, Doc, again, thanks for taking so much time with us. I know we went way long, but this was really good and really important for a lot of people. So, Dr. Ryan Jennings, Chief Medical Officer at HSHS St. Anthony's Memorial Hospital, thanks so much for joining us, as always.
My pleasure, and thanks to WXEF for getting us on.
Absolutely.
Thank you.
Take care, Ryan. Thank you. Always good to talk to Dr. Jennings. He is an absolute wealth of knowledge.
Good words.
It's just fantastic.
He is.
So, it's just fantastic. So, it's just fantastic. So.